Hello, everybody. So, right, a couple of things. Right, the purpose of this here is just to kind of talk about the exam that will be coming up next week. Right. Don't worry, you're not seeing like a mirror image or anything like that. There's not an issue on the video. I have two separate PowerPoints pulled up side by side, and what I had done is, right, just so you'd have a better idea as far as, all right, what should I look at? What should I focus on? What should I look at for the exam for next week? What I did is I went through the PowerPoints and I stripped off the different labels, and then I put across certain slides that I wouldn't be using any images. So rather than try to elaborate and explain to you in a 3-paragraph document, I figured I would just post this so you can actually see what what I'm actually talking about. So for instance, this here on the right, this is the PowerPoint for which you guys already have, where you have all of this stuff. This is the PowerPoint that you already have. On D2L, right, I've also, this one is special senses stripped, is all it means. So basically what I did was, for instance, right, this image, I could potentially use this on the exam for next week, and you can see how I've stripped off the labels. Right, so as you go through, right, for instance, the document, make sure you're able to identify what these particular structures or what these particular regions or what these particular lines are pointing to. Right, same thing. Next slide. All right, all the different structures within the olfactory epithelium, right, the olfactory tract. Same thing. I stripped off the different titles, the different names of the structures, so therefore you can identify them. Right? It's kind of a way to allow you to study. Now the next slide, you can see, right? This is the one that, again, the one on the right, you guys have access to this one. You have access to both of these, but this one on the right, that's the one I had used, that's the one I presented on. On the left, this is the one that, in this PowerPoint, this is the one that has the images where the items are stripped. These are what I want you to focus on for the exam for next week. You'll see no images utilized on exam, meaning this slide here, I will not be using this slide, I will not be using this image to cover or ask any particular questions. Yes, I covered olfactory receptor cell, supporting cell, olfactory cilia. Alright, sorry about that. You probably heard my 5-year-old screaming upstairs. Don't worry, she's still alive and still breathing. But this slide here, right, I will not be using this particular slide to ask you any questions on. Right? Same thing for this next slide. Right? No image is utilized in the exam. I will not be using this image. Same thing here. I will not be utilizing this image. Not be using it. Not be using it. Right? Now, right, again, I'm going to stop stop referencing the one to the right because this is the one that you already have with all the labels on it. This one here is the one that's stripped, and you can see here, right, all the arrows are pointing to different papillae, circumvalent papillae, lingual tonsil, right, epiglottis, filiform, papillae, so be able to identify these different structures on the tongue, because I will be potentially using this image on the exam. Same thing here, right, circumvalent papillae, fungiform papillae. Right, make sure you can identify these. Again, same thing here. Right, so as you go through, no images utilized. No images utilized. Right, this one's a little bit more difficult to see. If I change the color maybe here, this one a little bit. Right, no images. Right, same thing, no images, none. Here. Right, we'll get back into where you see these lines, right, and the corresponding slide that's labeled looks just like this. So be able to, right, know that, oh, this is the upper eyelid or the upper palpebrae, right? This is the lower palpebrae, right? The white part of the eye being the sclera, right? So just be able to identify these different structures. Right? Same thing here, and I forgot to take off these ones. But same thing, just like these labels here, go through and be able to identify what these different structures are, because these are the exact images I will be utilizing. Which hopefully you're like, oh my gosh, this is awesome, because you already have this image, you already have this exact thing. I'm going to be utilizing exactly what it is that you have, right? That's one of, right, that's, granted, this is all done kind of remotely, we're not able to use the models, but one of the benefits is that you have these images, you have access to them 24/7. The models that we use in lab, you only have access to them when we are in the actual lab. So that's one of the downsides that many of you guys have expressed to me, and you've always expressed, right, regardless of the class, is that these labs, or the labs, are tough to utilize the models because you don't have access to the models outside of the lab. Well, here we're not using the models, right? We're using these images, and you have access to these around the clock, right? So I'm not going to keep going through all of them, but you can see, right, how the corresponding picture, right, no images utilized. This image here, you can see how all the different labels on it. So again, if you're like, oh, how do I study for the exam? Go to these images and, right, be able to point out what is being looked at, right? What structure is being identified. Right? Does that make sense? And same thing I went through and did on the nervous system. There we go. Right? No images utilized. No images utilized. All right, here you can see all the different structures that I've stripped off. Same thing. So how do I study? How do I know? Go to the structures where I have the image, where I have the label stripped off. Go to those images where I don't have, for instance, the big tag, no images utilized. But if a slide doesn't have that on there, you could potentially see that image on the exam. Right? So same thing. All these different structures, right? No images utilized. Same thing, be able to point out all these different structures. Right? So therefore, again, right? This is just like the first two exams, right? I'll be identifying, right, having an image, having this image, having a different image of the tongue, whatever it happens to be, and they'll be asking you the name of the structure, or the name of the particular region, for instance. And as long as you've gone through and done this, right, I will literally be using this exact same image, right? Like for instance, on the right on the exam, hold on, sorry, just giving you an example of what you might see. No, this is cumbersome, but it's all good. It is all good. Right. So, on the image, right, you might see something like that, and it might ask you, right, identify this plexus. Right. I mean, if you look, right, this arrow, I mean, this is exactly what it is. So, if had you studied this, right, the slide previously, you would know that it's the cervical plexus. Right, so again, look at this image, or look at this PowerPoint, right? The nervous system stripped image, or the special senses stripped, right? PowerPoint, and utilize that to study with. All right, so again, there's not a specific, list or something like that I'm going to be putting up. Right, I decided to do it this way. That way, you literally have the exact images, you have the exact arrows, you have the exact thing that I'm going to be pointing at and pointing to. All right. Again, if you guys still have questions, please reach out to me. Again, don't hesitate. Please reach out, ask questions. Right, I'm here for you. All right, not just a smiling face or a soothing voice. Although soothing, whatever kind of voice you want to describe it as. All right. So again, if you have questions, please reach out. All right. Everybody, take care.